right, well, today senior administration officials will hold a briefing on President Trump's plan to lower prescription drug costs.
We are not going to reward companies that constantly raise prices. Our plan will end the dishonest double dealing that allows the middleman to pocket rebates and discounts that should be passed on to consumers and patients.
This is just the latest move as the Trump administration tries to fix what they call the broken healthcare system. So what are the steps they've taken? Here now to break it all down is Fox News Medical Aid Team Dr. Marc Siegel. Now, Doctor, what can we expect to happen here? I know that when my grandparents were sick, they were on 5, 10 medications at a time, and it can be really expensive, especially for people on a fixed income. So when people go to the pharmacy, will they actually see the cost of their medication decrease?
Absolutely, Carly. And President Trump already pointed out that one of the first things you're going to see is the middleman is going to be getting less of the profit. More of the savings will come to the patient. List prices of drugs are sky high. Prescription drugs are over $300 billion a year in the United States right now. Falsely inflated list prices leads to middlemen coming in and gouging out their profit, but the patient pays more out of pocket. All of that is being cut down on. There's going to be less hidden prices. President Trump talked about more price transparency, where you're going to know what prescription drugs actually cost, and then rebates will come into play so that prices won't be as inflated. Again, less out-of-pocket payment by the patient.
And you say competition is also key, right?
Well, competition is key, and here's how competition is going to come into the equation. There's going to be more generic drugs approved. FDA is already working on that. Last year, over 1,000 new drugs were approved that were generics, most on record ever. Why? It's getting easier and easier for a generic to be approved. Why does that bring down prices? Because generic drugs are cheaper.
Yeah.
So instead of the brand name drug being able to hold on to the market longer, cheaper drugs will come in. They'll cost less. That's a huge improvement. President Trump is doubling down on that.
Let's get to a graphic real quick of what the president's plan will include. And it includes lower drug prices for seniors, persuade other countries to pay more, require price shown in drug ads, and ban gag clauses for pharmacies and end the patient games. The one thing that I found really interesting is this gag clause situation where pharmacies couldn't tell patients about lower cost drugs. Why did that ever happen to begin with?
Well, that was always in the benefit of brand name drugs that didn't want you to know that there was an alternative. Same thing with the point that's in there, what you just talked about with foreign freeloaders. I mean, can you imagine an entire country like Germany comes into play and says, we're only paying this amount for your drug, and the drug manufacturer says, sure, okay, you have millions of customers, we'll accept that, and then we'll pass it along to our people back home. That's going to be ended now.
And it's also amazing how expensive drugs have gotten over the past couple years. In 2006, the average annual cost of medication was $4,000. By 2015, that had tripled to nearly $13,000. How could that have happened over such a short period of time?
Because manufacturers always say it's research and development. It costs over $2 billion to get a drug to market. That's their excuse. But then they're passing that cost along to us, not along to foreign countries. And then you have, again, these middlemen that come in and price gouge. Yeah. The whole thing gets inflated. That is all going to be addressed right now. Price transparency, we want to know what we're paying for here.
Is something.
And seniors are being targeted to get more benefits.
Yeah, and those are the folks that shouldn't, because a lot of seniors can't really afford it. This is something that a lot of people care about because it affects their health, it affects their finances. So if the president can really, change the situation, it will be a major win for the Trump administration.
Carly, if you're over 70 years old and you're on a fixed income and you're going to the pharmacy, the last thing you want to be told when you're getting, as you say, multiple medications is, by the way, pony up another $50. Absolutely. You don't have it.
Well, Dr. Siegel, thank you so much for breaking this down for us so much.
Good to see you.
All right.